Good afternoon. I'm Monroe Pattillo. I'm one of the two planning committee co-chairs of the IHE patient care device domain. Not as a panelist, but out there listening is Kurt Eliason. He's also one of our planning committee co-chairs. We have also two technical committee co-chairs. John Rhoads of Phillips Healthcare is one of them, as is Tom Kowalczyk of B. Braun. Today I'll be leading the annual education update for the PCD domain. John Rhoads may come on a little later to provide some information regarding one of our new white papers on patient care, point of care identity management, but I'll cover the lion's share of it. Next slide. The patient care device domain has been around for some time. It was formed in 2005 to address the point of care device integration needs. The idea is to enable as much as possible out of the box, reliable, functionally interoperable solutions. We use open processes and open standards. We have open standards that are out there for use as the underpinnings of what we create. If you understand the IHE process, we take standards, take the gray areas and try and get them more black and white and fill in any holes through either specific content or extensions of the standards by going back to standards committees. The dominant standard that PCD uses is HL7 version 2.6. Some profiles draw upon 2.7, 2.8, and for FDA UDI, we use 2.8.2. Internationally, some of the profiles are used at a much lower HL7 version level. Specifically in Japan, it's much less than 2.6. So they miss on things like body site in the observations, but they're still usable profiles. We also make use for object models and nomenclature, the IEEE 11073 standard. For communications out to mobile devices, we use the Wireless Communication Transfer Protocol, or WCTP, and also for consistent time, all of the PCD profiles, with the exception of IDCO, use the ITI domain's consistent time profile. The PCD domain could not exist without its co-sponsors, HIMSS, ACCE, and AAMI. Next slide. As was mentioned, the focus of the PCD domain is on devices associated with patients, be it patient monitors, vital signs, pulse oximetry, ventilators, all sorts of infusion pumps. We also have a focus on collecting and reporting data from devices for immediate access and for storing it as retrospective storage in things like the EMR for the patient records. We use the device to enterprise communication dominantly for storing that information in the EMR. We can also use the Continua Alliance to feed the home healthcare data through a gateway from its more XML-ish format into HL7 version 2.6. We also support a profile that does implantable cardiac observations, so for pacemakers, etc. They're implanted, so obviously they can't do things like network time protocol, but we define profiles that allow gateways to receive the data, include the timestamp information, and then pass that on to the EMR. Once the data is stored, we also have a profile for getting the data back out based upon a query, and that's retrospective data query. Next slide. We also focus on getting the alerts to healthcare staff, be it clinicians, physicians, clinical engineers, IT relating to the management of the infrastructure, and we do that over local wireless, mobile, wireless services, and desktop devices. And for that, we use the Alert Communication Management profile. We also pay attention to things like infusion safety, with our point of care infusion verification profile that adds a sixth right, as in the right pump device associated with the infusion order. And then the events along the process of an infusion are also recorded through our infusion pump event communication, which is a specific form of the generic event communication. Next slide. Across all of the patient care device domain profiles, we use consistent data for observations, events, units of measure, and enumerations. And we catalog all of this through a profile that we refer to as Rosetta terminology mapping. There is an online system that's available 24/7 that you don't even need a specific login to gain access to. It's referred to as the Rosetta Terminology Management System, or RTMMS, and it is maintained by NIST, and we're thankful for their support in that regard. We also offer waveform communication. It's not a profile, it's more of a messaging module that can be used in the DEC and the ACM profiles to communicate evidentiary data that can be used in the synthesis of waveforms for either live continuous display or for static display in alerting. A couple of years ago, we focused on sort of areas that we need to fill in that might be gaps within the PCD set of profiles. And in this regard, we now work on medical equipment management. So this is not specifically the patient involvement with the equipment, but more of the management of the equipment that is used in conjunction with patients. So we have a couple of areas that we focus on in medical equipment management. One is the communication of observations by the devices to things like the computerized maintenance management systems, the location of things, be those things devices or people in the healthcare realm, and then the secure use of the devices. So we have focus specifically on cybersecurity involving things like the protection of the device from hacking and also updating of the devices for things like patch management. Next slide, please. So now I'll get into sort of a one-pager synopsis of each of the major profiles within the PCD domain. First and foremost is the device-to-enterprise communication. If a device has an observation that needs to go into the patient's medical record or is used for decision-making purposes or for research, we need a common way of getting that information from the device into the storage facility or the consumer of it. You'll note that all of the messages within the PCD domain profiles all start with PCD and then a number indicating the transaction number within the PCD domain. So DEC coming out first gets PCD 01. Because there could be a flood of observation information, we also support the optional ability to put a filter in line to identify just what information the consumer would like to receive, and then filter that down to store, not the entire flood, but specific information on a time basis or a patient basis. Next slide. So if a device has an observation, we use the DEC profile to communicate that for storage. If the device has an alert, then we use the ACM profile for that. Alerts are a big picture item. If you were to examine a Venn diagram of what an alert is alarms that are technical or physiologic, and advisories. So you can think of anything that you need to notify somebody about, be it urgent or be it, we can get to that a little later, winds up being in the realm of alerts. So if you have a physiologic alarm, that's a kind of alert. If you have a workflow notification of the next step to be performed that you can get to in a little while, you don't have to tend to at a critical time frame, that's an advisory. That's also an alert. So we have a common profile for communicating alerts. We have reporters. That's the device or its gateway that produces the alert. It then goes to a manager. The manager is responsible for synthesizing the alert text message that will go to the individual, and also for identifying the mapping of that particular alert to who is to receive it on what kind of device. And then, because you can have the same kind of alert going to different clinicians on different shifts, and the ACM profile abstracts all of that assignment management from the reporting system. So all they do is they produce the alert, the manager maps it onto which clinician for which patient gets it on this duty shift, and then sends that out to the communicator. The communicator is the abstraction for all the various interfaces to different types of mobile devices and desktop systems, so that the alert manager doesn't have to know, how to send something to a display, be it an Android or an Apple or a Windows desktop or whatever. You have a common interface for that. The common interface from the alert manager to the alert communicator is that WCTP protocol that I had mentioned earlier. The protocol from the alert reporter to the alert manager is HL7 2.6. When an alert is first started, it creates a history of itself that is tracked until its conclusion. And the way we manage that is through something we refer to as a phase. So an alert can have a start phase, or it can be already existing, so it can be present. And then that alert can change over time and eventually be ended. So it's important for the alert reporter to recognize the phases and send that along to the alert manager. One of the things the alert manager can do is, if an alert is handled locally by a clinician and the end of the alert occurs, then that can be passed along to the manager. The manager can then do things like send a never mind and indicate who is actually going to be handling the alert or who has already handled the alert. So it improves the efficiency of the workflow for alert management within the care unit. And then we have two-way communication. So there are means of indicating that the alert has been received, read, accepted by the recipient, rejected as in I'm too busy, or canceled as in, I've walked into the patient's room with my mobile device and I've canceled the alert. As sometimes for things like nurse call, there are telephony dialbacks to the pillow speaker of the patient to talk with the patient. That information can also be recorded in the alert communication management messages. Next slide. As I mentioned, we also pay attention to the safety of infusion order processing. So you're probably familiar with the 5 rights of right patient, right medication, right dose, right time, right route. But the PID profile adds in 6th right of the right device. The device is identified and that information is passed in for confirmation. This allows for the infusion device to be programmed based upon the order as managed by the medication gateway associated with the infusion device. So this reduces errors in programming of the infusion device. It also allows for better recording of the infusion order and its association with the device. The overall goal here is to improve the safety of the infusion device in association with the patient and to provide a recording of the association of the device with the patient with the medication. Next slide, please. So as the infusion is occurring, whether it was programmed in automation through PIV or manual programming of the infusion device, you'd like to be able to get the events along the way should the infusion be paused and then resumed, or a progress update as to how much has been infused so far. You'd like to get that information into the patient's record, and for that we use the infusion pump event communication profile. So as the infusion is going along from start to completion, that information can be stored in the patient's record, or at least in the device's record. Next slide. As I mentioned earlier, we have a profile that does special handling for the accuracy of time of day updates, and that's the implantable device cardiac observation, or IDCO. When you go in to get your update of your current status of your pacemaker or defibrillator that's been implanted, that information comes out to a gateway device. That gateway device processes the data, converts it into a deck-like format on HL7 version 2.6, and then that can be stored in the patient's record for later review. Next slide. So if all we did with the deck profile was to store the data, it wouldn't be very good to call it back. You need a mechanism for doing that. So we do support the retrospective data query profile, which once the data has been stored in a central server, you can query it to get the data back. And you can get the data back based upon patient or time. So you can focus down to a specific time realm to show what happened during that on a specific device, or you can do it in association with a patient. So if you have to do analysis of something that occurred, you can pull that information back with retrospective data query. Next slide, please. As I mentioned, waveform content is something that we focus on with the DEC and the ACM profiles. There are two forms. One is that you can have a live streaming waveform that's continuously updated, or you can use the evidentiary data, package it up, and send it off in your alert communication management report to provide a waveform snippet. We do allow multiple types of formatting of the data. So if you have an alert and you want to send that out to a mobile device, there's a wide variety of mobile devices out there, some of which might be able to take live streaming data, and they're medical devices. If you look at the mobile medical device guidelines from the FDA, essentially if you're taking the evidentiary data and converting that into a displayable waveform, you probably should go, evaluate whether it should be a Class 2 device or not. If you're just displaying an already generated static snippet, you're probably a Class 1 device and don't have to go through the same level of scrutiny and management and recording. But the ACM profile using WCM does offer both live and static waveform displays. And the waveform information that's passed in the evidentiary data also includes things like filtering and annotations. So you can see more than just sort of a line going by. You can actually understand data in association with that recording. Next slide. As mentioned earlier, we've moved from just focusing on the equipment to patient relationship to the management of the equipment that is used in association with the patient. So we have a couple of profiles for that. We have device management communication, or medical equipment management device management communication. It's a short acronym for something very long. But the idea there is that the devices can produce observations that are not necessarily patient-related, they're equipment management-related. So we have a means of communicating that. Also, the equipment management information can be used in conjunction with other profiles, such as the DEC or ACM profiles. So it allows for things like the identification of the equipment, the last power fail status of the equipment, the power source, be it mains or battery, battery status, battery charging status. That information can be communicated by MEMDMC. But if you do have a piece of equipment that needs some assistance from clinical engineering, if you know where it is, then that improves your ability to just go in and service the equipment. So we have the medical equipment management location services profile. What this profile does is, and I love the word abstracts the receiving system from the variety of technical approaches to identifying the location of objects. MEMLS focuses on how to identify the location of something in multiple ways. You can have the location based upon the architectural hierarchy within the hospital, the sort of point of care room bed or name of location. You can also have a LS system reporting to another LS system, in which case you have a base map plus an XYZ offset that you can report, so that you can have the sort of moving maps view of where things are. And we also pay attention to it as it goes beyond the hospital's structural environment. MEMLS also supports GPS-based location identification. Obviously, a clinician wouldn't care so much about that, and that's why we support the hospital structural identification of location. But we take it beyond just the observation of location. We also have means of identifying location associated with alerting. So you have alert conditions associated with the location monitoring tags for things like when tags get put into refrigerators and freezers and the temperature goes out of range. Tags associated with environmental measurement of gases or pressures. All those sorts of things can produce observations on a regular basis, but they can also produce alerts. And the MEMLS allows you to map those observations and their alerts into things like ACM for communicating them to people. Initially, the idea of MEMDMC and MEMLS were to provide analytical analysis of the efficiency of equipment. So you can tell, am I efficiently using all the pumps that I'm purchasing or leasing? But we've gone quite a ways beyond that. We're now looking at the management of the equipment from a recall perspective or an updating perspective as a future for MEMDMC. In the current cycle, we're paying attention to the communication to the device. Initially, we just focused on communication of observations and alerts from the device. We're now creating a mechanism whereby you can communicate to the device for things like pausing alerts, for clearing infused thus far status once that gets recorded. So we're looking at good opportunities in the future to expand MEMDMC. Next slide, please. Okay, not every device that's in the world of healthcare can use, high-speed internet, high-speed Ethernet LAN interfaces, or Ethernet, or even wireless interfaces. Some still have RS-232 asynchronous serial ports on them, which don't run at the same speed. Therefore, the volume of data and the formatting of it must pay attention to the lower bandwidth of these interfaces. While it's not a specific profile, we do have the optimized message syntax message profile. It can be used with any of the profiles such as DEC or IPEC or even ACM to shrink the amount of data communicated from the medical device into the next system up, dominantly being the EMR, but for other purposes as well. The idea is to reduce the load on the serial interface. There can be a gateway in between the device and the information destination to fill in the details or expand the data back out. But OMS, if you read the content of it, is really focused on, even though it's reducing the volume of data, it's still trying to create data that is meaningful in the patient's record, even if it's not expanded back out. So that's what we use OMS for. Next slide, please. This is the rat's nest of communication. If you were to look at all of the various profiles that the PCD domain utilizes and then identify what is the use of them, not specifically the use cases, but what role do they play in the patient's healthcare story. It's all about the device interoperability. Can you get item A to talk to item B for a useful purpose? And you don't have to absorb this diagram all at once. You can pick by color and say, well, I'm focusing on, for example, getting my implantable device information into the patient's record. So you start at the top center with the implantable device. You go through the IDCO gateway. You use the IDCO profile. Follow the yellow arrow into the patient's record. Great. So let's say I wanted to have an alarm from a physiologic monitor wind up in the hands of a clinician. So top, just right of center, physiologic and vital signs monitoring, comes down ACM, possibly with WCM embedded. On that red line goes to the alert manager, goes to the alert communicator, and winds up on some mobile device associated with a clinical staff member. So you can see how this one big picture allows you to go in and look at the usefulness of each of the profiles within the PCD domain and a bit of where we are going in the future. Next slide, please. So PCD has a number of profiles, and they really wouldn't be useful unless they were verified. And we use NIST as our supporting agency to create tools that allow us to verify the proper operation and profile conformance of vendor implemented solutions. So if you take the assertions that our profiles and PCD technical framework create and you apply those to a system, and then you take test data from sending actors to receiving actors, and you verify that data based upon the assertions, you wind up with a report that says whether or not this particular vendor implementation of this profile is in conformance. It's not certification, it's verification. The NIST tools allow you to do this sort of whenever you wish to do so. They're automated tools. You can either use them as copy and pasting of messages, or you can actually use the test harness for remote communication of the messaging. Next slide, please. So the messaging that we use does go through services that NIST provides in order to get that information into the test tool to establish a test environment for the execution of the test, so that as the messages are pasted in or flow through, then they can be verified on the fly and produce your report as a result of that. The reports can be stored if a vendor chooses to sign up for a login on the tools. They can be stored such that that information can be used in the future to improve. If a profile shows up with a lot of vendors getting the same issue, then we can use that information that's been stored to identify any improvements in the profiles. So it's a closed loop mechanism for verifying that we have good profiles and that we have vendors that make good use of those profiles. The NIST testing tools are available for pre-connectathon use. They are also used in a live fashion during the actual connectathon verification testing. It's a lot to talk about discussing the NIST tools. John Gargiulo of NIST could give you a hour-plus dissertation on just the tools, how they're implemented and used. Next slide, please. So this is just a quick synopsis of what we're currently doing within the PCD domain. We're trying to come up with a catalog of the alarms and advisories, alerts, for use in ACM, so that we can essentially define the observations to be used in association with different kinds of alerts, so that there is essentially Rosetta consistency from one implementation to another as to what you can expect to receive in a specific alert for a specific device. As you can tell, this would be a very large catalog, and it's taking us multiple years to pull it all together. So that's a work in process. PCD is a domain within IHE, but there are other domains within IHE as well, and we do pay attention to what they do that might interact or run parallel to what the PCD domain does. The IT infrastructure or ITI domain within IHE implemented a mobile ACM profile, which makes use of the FHIR HL7 protocol instead of HL7 version 2. We do pay attention to that, and we've actually done an improvement to our ACM profile to allow the FHIR-based messaging for the reporting of alerts. We have white papers out there for patching and security management of medical devices. We've enhanced the MEMDMC and MEMLS profiles, given the experiences at demonstrations, as well as the connectathons. So we've done change proposals to those. IEEE has a location services for healthcare working group. We do work with them. They've made use of our MEMLS data communication for location services, which allows them to more closely focus on the technologies associated with location observations as well as the accuracies of them. Something that is new is the point of care identity management white paper that's coming out this cycle. I believe it should be published by now, so look forward to that. That is the device-to-patient associations and recording of those associations so that other systems can know that this specific instance device is currently associated with a patient. This information can not only be used for dashboard type purposes, it can also be used to understand when you need to do something in association with a patient, all of the devices that are currently associated with that patient. Plus, the information can be used in device efficiency and effectiveness monitoring, so that if you know all the times a device is associated with a patient, you know it's being utilized. Plus, you also know that the device is utilized can lead to better management of the maintenance of the device, and that you don't have sort of a calendar static cycling of maintenance on the device. You have device usage-based maintenance. One of the things that we did last cycle was to start identifying version management within the profiles using the HL7 version 2 message header field 21 and ISO OIDs for the message identification. The PCD domain has been using OIDs for some time, but last cycle was the first time we actually versioned a profile using the OID information in the message header. As we've been increasing the data regularity of MemDMC and MemLS, it was time to start filing for official standards-based nomenclature for the observations and events and attributes associated with MemDMC and MemLS. To that end, we've submitted for inclusion in 11073 10101B requests for MDCs and ref IDs. Once those are updated and we get the official numbers, we'll do change proposals against the two profiles and then come out with a new version of the trial implementation next cycle. As you can tell, this is on a path towards getting it to what IHE refers to as final text for inclusion in the technical framework in an upcoming cycle. So as I mentioned earlier, we pay attention to what's going on in the other IHE domains, and the ITI MACM profile and its use of FIRE specifically. In this cycle, we issued and got approved a change proposal to the ACM profile to optionally allow reporting to the alert manager using FIRE. So an ACM alert manager has at its option to use either HL7 version 2 or HL7 FIRE for communicating alerts. So when FDA announced UDI, they didn't give a whole lot of detail in the communication from devices as to their identification. And they kind of left that on HL7. HL7 came over to PCD and said, when are you guys going to figure out what this is? So the PCD domain has been working with the HL7 Orders and Observations Working Group, of which a number of our members are members of that working group, to come up with updates to HL7 version 2. And as of 2.8.2, extensions have been added to support UDI. The use of those extensions is a part of the PCD technical framework. So wherever you need to communicate FDA UDI, you can look to the PCD technical framework to identify how that is to be communicated. And for overview information, you can look at the FDA UDI white paper produced by the PCD domain. The waveform communication management has been demonstrated a couple of times at both last year's Connectathon and the 2016 HIMSS Interoperability Showcase, and at AMI as well, at the AMI Interoperability Experience. So we're moving forward on that. The next step is to offer similar waveform viewing in the ACM profile. But as you can tell, we need a reporter, a manager, and a communicator all subscribing and implementing WCM in order to be able to demonstrate that. And in this cycle, we'll also have an update to the PCD technical framework for both housekeeping, any text errors that we find, or additional information we can add that will clarify things, plus any change proposals that have been approved. Next slide, please. So in the future, we'd like to have a white paper come out that's regarding device remote command and control. As I mentioned, MemDMC started out as receiving data from the device. We'd also like to be able to send commands to the device. We're going to do that in as generic a transport mechanism as possible to pay attention to the safety and security issues associated with commanding a medical device, and use a couple of real-world examples as the means to identify how to do this for specific use cases. We also are going to be paying attention to device specializations, in particular SpO2 devices, the various types of pumps and ventilators. Those will be work going forward. So also improving device management and its location for safety and availability, identifying means to define the utilization of a device, so you know whether you're using them effectively or not. Various means for location. We did extend the MEMLS profile a little bit to identify basically what happens when you can't get a GPS fix. This was for hospital external tracking, but the U.S. government and military aspects needed a means of identifying what happens if you have a GPS failure and how to use inertial navigation to accommodate this. And the MEMLS profile was touched up to make reference to that. Failure alerts associated with device management. There's a variety of those, an increasing number of them, and who to send them to. Battery condition, multiple batteries in a device. The self-test. It's nice to know that a device is passing its self-test, and if not, provide a means of setting that device aside or getting someone to come and take that device aside. Improving the asset identification and the management of it, be it the software and hardware versions, as well as the tracking of the device through its multiple identifiers, be it FDA, UDI, manufacturer serial number, asset tag numbers, and then getting the technical management aspects of the devices into focus as well, pulling back error logs, and being able to access the device status logs. And as I mentioned earlier, communication of these software and hardware versions for things like revision control, patch management, and recalls. Next slide, please. So as the community out there paying attention to IHE PCD, we have two focus areas. One is on the vendors, the other one is on users. So if you are a vendor, please do support the mission of IHE PCD. Become an IHE member. We'd like to hear from you. Participate in the efforts. It's okay to just listen, but it's even better for us to hear. That increases the consistency and the conformance across all the vendors. Sort of plant the seed. Support IHE profiles in your interoperability, and encourage active participation by other IHE, by other vendors in the IHE interoperability. And do request that if you've gone through the effort to create your implementation of your product that is IHE profile conformant, and you've done the appropriate verification, testing, documentation, suggest that customers buy the products based upon their compliance. Produce the IHE integration statements that show that you as a vendor claim that your product is conformant to specific IHE profiles as specific actors. Do participate in connectathons to demonstrate to your customers that you are verified for the conformance to those profiles. Do promote, once you've passed a connectathon, do promote with your customers the browsing of the connectathon results website and the product registry website. This allows them to autonomously review your product to see that it has implemented IHE profiles and that they're confirmed through Connectathon and that you've registered that product. As a vendor, do participate in interoperability demonstrations, both at HIMSS and at AMI. Next slide, please. So as users, also support the mission of IHE PCD. Users can become IHE members. We'd like to get your voice into the dialogue. Do encourage active participation by users. Do purchase IHE PCD profile compliant products. Look for integration statements. Typo there. Look for integration statements from vendors that state that they are conformant to IHE profiles. As verification through an external source, do expect vendor participation in Connectathon. Do look for the vendor product of your choice in Connectathon results and in the product registry site. If you have the opportunity to be at HIMSS or at IHE, do take a look at the live interoperability demonstrations. Come up, ask questions, watch what we're doing, and do purchase commercially available products. The PCD domain does maintain a commercially available list. We'll get into a little bit of detail on that. Next slide. So as I mentioned, the commercially available devices and systems. The list is too long to present in this presentation. It would be several slides of fine print. So we do provide an FTP link to go off and look at the current one. We do have one that's for last year and one for this year. Typically, after we've had a Connectathon, where we have vendors that have demonstrated verification of the profile conformance, it's easier to update the document with that information at that time. So we'll be doing one after the upcoming Connectathon. Next slide, please. So it's a lot of information to take in about 40 minutes. So you might want to look somewhere additionally for information as to specific profiles or the PCD technical framework. And for that, you can visit the IHE PCD website. We have a wiki associated with the domain. If you want to look at the tools, so if you think you've already implemented something that is IHE PCD profile conformant, you can actually go in and look up the information in the Rosetta terminology mapping management system. So you can find that your observations, attributes, and units of measure, etc., would be conformant. And then you can actually run the pre-Connectathon testing on your data. And you can also use the actual Connectathon test tool prior to Connectathon. Next slide, please. And should you want to get really serious, you can actually contact us. The co-chairs are listed on the IHE website as the leadership of the PCD domain. If you want general information, you want to be included in our weekly working group webinars, you can contact Paul Sherman. We give you his email directly as pcd@acce.net, accenet.org. We also include a link to the Connectathon results should you want to look up a particular vendor right away. Plus also there's, again, the link to commercially available devices and systems. So you get a breadth of information all in one slide. Next slide, please. I think we're coming to the end.
We've actually reached the end of the
presentation. Okay. So at this point, we'd be looking for any questions or answers that people might have here. I don't see any.
I have unmuted the lines for anyone who would like to contribute their questions at the moment.
I know it's a lot to take in a short time.
I have not received anything via chat.
Okay. The PCD domain is what they refer to as a mature domain. We have a technical framework that's been through multiple iterations. We have multiple vendors implementing each of the profiles in different actor roles. We've demonstrated it at multiple HIMSS interoperability showcases, as well as multiple IHE annual conventions, both initially in the PCD demonstrations and as of this year in the IHE interoperability experience. So we'll continue to do that. Do reach out to us for any questions or comments that may come up after the presentation. The profiles, as with all the IHE profiles, white papers, etc., are all freely downloadable from the website. So you can take a look at that. And if you do come up with questions, please do contact us. But I guess that does it for today.